this video we're going to learn all about chronic pain, also known as persistent pain. We're going to find out what it is, a little bit about the science behind it, how common it is, and what we can do to help manage it. So what is chronic or persistent pain? Well, any pain that resolves within 3 months we tend to call acute pain, like maybe a sprained ankle. And any pain that goes on longer than this is chronic pain. And often there is no physical cause of the pain found, or the pain goes beyond what we would have expected. But it's really common. You may be thinking you're kind of alone here. In fact, people, because it's an invisible disability, can feel quite isolated, which can make the chronic pain even worse. So it's really common. In fact, 28 million people, it's estimated, suffer with pain on a day-to-day basis. That's 30% of the UK population. And it's not just old people or people who have multiple health problems, it can affect anyone. So it's really important to have the message that it's common and can affect anyone, but recovery is possible. And recovery will be different for different people. So you may be hoping that you'll be pain-free completely, and maybe you will. But for most people, recovery will mean a reduction in their pain. So you may feel the cause of your pain is because you've had an abnormal finding. For example, you've had a scan or an x-ray that shows something wrong. But sometimes this is just a normal part of aging, or may not be the cause of your pain. Doesn't mean the pain's not real. We know, for example, thinking about back pain, that when people are in their 50s, 80% of people have something called disc degeneration, which sounds really scary, and 60% of people have a bulging disc, even if they have no pain. So just because there's been an abnormal finding doesn't mean that's necessarily the cause of your pain, and sometimes focusing in on that can actually be rather unhelpful rather than helpful. But it doesn't mean the pain's not real. So why are you finding yourself getting pain if I'm telling you there's not necessarily anything physically wrong? It's because something has gone wrong with the computer system of the brain and the pain signalling. It's a bit like a faulty alarm signal. It's become oversensitive. And even when it doesn't need to alarm, it's alarming, it's worried about you, it's trying to protect you, but it's become overprotective. The good news is we can dampen down this, because the brain can also be learned to change the way it's thinking, and this is called neuroplasticity. So a bit like you would reboot a computer and turn it on and off again, your brain can unlearn these overprotective mechanisms. Certainly not as easy as turning a computer on and off again. In fact, it's not going to be quick, and it won't be easy. You're going to need support from your family and friends and the GPs and nurses and pharmacists. But it is possible. And I think that's a really important key message, that recovery is possible, but it isn't easy. And so if you just think about this faulty alarm system, and that's why you've got the pain, even understanding that can make you feel empowered and in control. You can perhaps make decisions based on that knowledge that you might not have otherwise done. Once you know that this isn't actual damage going on in your body, it's your body being overprotective, you may make different decisions and feel more in control of your pain, which is the first step on the road to recovery. So what about medications? Well, we know that opioids like codeine are really useful in acute pain, so any pain that's up to 3 months. But it's really not a good idea to keep using these beyond 3 months, because they tend not to be that helpful. In fact, we know that on average, for chronic pain, drugs like codeine only improve the pain by about 7%, which is hardly anything, is it? And I'm sure if you're on any medications, you know that they come with lots of side effects. These side effects include drowsiness, which may sound not too bad, but if it's every day and you can't get on with your life, you can't even go to work sometimes, you risk falling over, that drowsiness can be quite important. You get constipation, which can be horrible. You can get risks of addiction, so obviously that's very serious. And even it can increase your pain sensitivity. So obviously we don't want that. In fact, NICE guidance say that in chronic pain where there's no physical cause found, or where it's out of what we'd expect that pain to be, beyond that, it recommends that we avoid opiates like codeine. We avoid drugs like benzodiazepines, gabapentin, even things like paracetamol and ibuprofen. In fact, it recommends we trial antidepressants. Now, even if you're not depressed, you might think, well, I don't want antidepressants, that's not going to help. But studies do show that it can improve the pain levels, as well as quality of life. It can help you sleep, and it can improve your kind of psychological distress that may be because you've got the pain. So it's worth considering that. This isn't going to be easy, and you may be thinking to yourself, how on earth am I going to get off these medications? Lots of patients say that to me. My pain is so bad, what are you going to give me instead? But think to yourself, are you currently pain-free with the medications you're taking? Are you getting any side effects? Chances are the benefits don't outweigh the harms for you with your chronic pain. So talk to your GP, talk to the pharmacist at your surgery, and have a think about trialling, reducing your pain medication and see if it makes a difference, and perhaps think about an antidepressant if you're not already on one. Okay, so what else can we do to help manage this chronic pain you're struggling with? I've already mentioned that I think understanding the science behind pain is the beginning of the road to recovery. And there are some amazing resources out there, most of it free. Websites such as Flipping Pain and also the Pain Toolkit are brilliant. I'll include links in the description, so I really recommend you have a look in there. The next thing to think about is increasing your activity levels. And you may be thinking, all right, that's easy for you to say, but I'm in pain every day. I understand that. And therefore, I'm not suggesting you go and start a Zumba class 3 times a week. In fact, what you need to do is very much little by little, every single day if you can, do a little bit of exercise or activity that just brings you to the edge of your pain. But stop there. So even on a good day, you might be tempted to do a bit more activity, but don't, otherwise you'll pay for it on a bad day. And even on a bad day when you really don't want to do anything, try and just push yourself to do a little bit and include stretching on that. Because what we know is that inactivity actually increases this oversensitization of pain. And also it leads to weakened muscles, stiffened joints, decreased fitness levels, which then means you end up not doing the things you enjoy so much. And then that can make your mood worse, and that in itself can make the pain worse. So it can be a bit of a cycle. So however difficult I know it is, try and think about what you can do to increase your activity levels. And it might be doing a bit of gardening, it might be playing with the kids in the garden. We know the best form of exercise is really whatever you're enjoying, because that's the thing you're most likely to keep on doing. So try and do a little bit every day. Physiotherapy is really helpful. They can show you how to move properly, teach you certain exercises that might be really helpful for your pain, and help you improve your quality of life. Psychological therapy, such as CBT, can be really important and help kind of rewire the brain. As I've talked about before, there is this neuroplasticity. So it can help dampen down these pain signals that you're receiving, also improve your mood and coping mechanisms, because it's horrible living with chronic pain, I'm sure you know. So do think about some sort of psychological support as well. Nice Guidance also recommends acupuncture, which may or may not be available on the NHS near you, but it's worth considering. And also just think about ways you could think about mindfulness and meditation. Even if you're not going to see a psychological therapist, there are loads of things available if you have a look on NHS websites to help with mindfulness and meditation, and that has been proven to help with chronic pain too. If you're off work, then it might be a good idea to think about trying to get back to work. Studies show that when people are off work, they tend to become more depressed and more inactive. So perhaps think about speaking to your employer about a phased return to work, or changes to your role that might make it easier for you to return to work. Speak to your GP, speak to your employer, and see what can be done, because getting back to work is also a way to get you on the road to recovery. And finally, your GP may suggest referring you to the pain clinic if you haven't already been. So if it's something you've not tried, it could be worth exploring as well. So in conclusion, my 4 key messages for you are: 1. Understanding the pain sets you on the road to recovery. Number 2, movement is vital. Number 3, get on top of your stress as much as you can, because we know that makes your pain worse. And number 4, try and reduce your reliance on medications, especially opioids and gabapentin, things like that. Ultimately, you'll feel better if you can manage to get off them. I hope you found that helpful, and I hope it's given you some idea that there is a road to recovery that's possible. Your pain can be improved, and you can get back to doing all those things you used to enjoy. Thanks so much for watching, and see you again soon.